Welcome back. I'm Dr. Steve Palazzo, CEO and founder of Back Wellness Revolution. In this video series, we'd like to demonstrate the technique that we teach in our Back Wellness Revolution certification program. The technique is called Rehabilitative Ultrasound Imaging, also known as RUSI, where we use ultrasound imaging to view the specific stabilizing muscles of the spine. Our first demonstration will be of the Transversus Abdominis. That is one of the most important stabilizing muscles. And in this technique or this assessment, we have the patient lying in a supine position so we can take an anterior lateral view through the abdominal wall using the ultrasound. We have a transducer, and we will take a positioning of the transducer will be just superior to the iliac crest and inferior to the lowest rib. We want to take an anterior lateral view here. And once you see the picture, the image of the angle we're taking, you will see the layers of the abdominal wall. The outermost layer is the skin, and just below that, the thin layer of subcutaneous fat. The layer below that would be the external oblique. The layer below that is the internal oblique, and the final layer of abdominal wall is the transversus abdominis itself. Its shape is a little different than the other muscles, and we'll teach you how to identify that. And deepest to that is the abdominal contents. That is not significant for our evaluation today. The three techniques we will use during this assessment will be a resting measurement of the transversus abdominis. Second will be the preferential contraction of transversus abdominis, where we have the patient try and isolate it. Now, Kelly will be able to isolate this muscle. She has been rehabilitated, but most of your patients will not. The final view will be an assessment of the transversus abdominis functioning during an active leg raise. So let's take a picture of the first. That is a resting state, so Kelly, just try and relax as best you can. Let your normal breathing pattern happen. And while she's still, we're going to get the perfect visual. Take a picture. The second view will be a preferential contraction, where Kelly, would you please take your navel and try and draw it down to the table or to the spine. Good. Hold. Great. And relax. And the final view is during an active leg raise. So Kelly, try and relax first. Great. You're going to keep this knee straight and lift up your left leg a few inches off the table and hold. Great. Good view. And we take a snapshot and relax. Great. With these three views, we can now take these images, put them into our software, take measurements, compare them to normal, and we could also compare baseline, a first visit, initial examination, with subsequent progress exams and a final exam to note patient's progress. And that is the demonstration of the anterolateral view of the transversus abdominis using rehabilitative ultrasound imaging.